Good day. I'm Dr. Kiwan, talking from the ECS heart. We're gonna discuss about the topic of the coronary artery disease in patients. As you may know, coronary artery disease is the first cause of heart attacks, as well as brain problems, cerebrovascular disease, as well as problems in all arteries in the body, where it can cause blockages. And these blockages are caused by many factors. Among all these factors are the cigarette smoking, shisha also eventually, as well as hypertension, problems with dyslipidemia, diabetes, sedentarity, as well as overweight and genetic family history. So one of the most frequent causes in our region in the Middle East is smoking, unfortunately, as well as diabetes. To prevent cardiac disease, coronary artery disease, one should first of all avoid smoking and stop smoking if he's already a smoker. Consult his doctor for high blood pressure. If the blood pressure is high, then it needs to be treated, and it can be prevented on the mid-long run during lifetime. Losing weight and exercising, avoiding sedentarity, exercising at least walking 20 minutes per day, at least 3 to 5 times per week, which is a great way of preventing coronary artery disease as well as peripheral vascular disease, and preventing against strokes. It means the brain damages following a deposit of cholesterol or a clotting in the brain arteries. Other way of preventing coronary artery disease is definitely to correct your cholesterol. If you have a high cholesterol, by addressing your diet, consulting diet experts, or avoiding all high-risk food. Obviously, diabetes is one of the causes of coronary artery disease, peripheral vascular disease, and strokes. So diabetes can damage the arteries wherever they are in the body, including heart, brain, and kidneys. So once you are diagnosed as diabetic, you must follow diets, you must consult your physician, the expert in diabetes, and get your diabetes very well treated to prevent yourself from coronary artery disease and cerebrovascular disease, as well as peripheral vascular disease. Obviously, genetic problems, family history, this you cannot do anything about it to prevent it. However, to know about it, you go for screening on a family level, and this is how you can discover that the whole family has dyslipidemia, what we call lipid problems, high cholesterol, high triglyceride, and this would lead you also to consulting your doctor and to be treated accordingly. Finally, we have talked about hypertension, smoking, diabetes, overweight, you lose weight, and sedentarity, you exercise. This is approximately everything about the risk factors, about the prevention. Now, what kind of medication we can take? Obviously, there are many types of medication for hypertension. All of them are good, and the best medication is the medication that fits your patient and that fits you well and that decreases your blood pressure. Obviously, there are differences between classes of medication, and this is left to your cardiologist or to your physician to decide what type of medication you need and what most optimal type of medication you deserve to protect your heart, to protect your brain, as well as your kidney. Now, if unfortunately you don't prevent and you reach the point where your arteries are blocked, either you will feel that you will have cramps in your chest, you will have cramps in your legs, or unfortunately you may evolve a stroke. Then you reach the point where interventional cardiology would then be the treatment. We mean by this, angioplasty means al-qastara. Angioplasty is to, first of all, you go through al-qastara to diagnose your blockages of the arteries, and once you find blockages on the arteries, then you can open them with balloons, and then a tad'im, stent, drug-eluting stent, or nowadays there are different techniques of opening your arteries. And unfortunately, if sometime your arteries cannot be open, then you may be oriented by your cardiologist to a cardiac surgeon to do a coronary artery bypass grafting. However, with the angioplasty and the high technology that is progressing very rapidly nowadays, and the high development of skills in cardiologists, interventional cardiologists, we may resolve most of problems by angioplasty, between brackets at-tad'im, al-qastara wa tad'im, stenting. And then once you get this treatment, you must follow with your cardiologist on a regular basis to prevent further complication and to preserve the benefits of the angioplasty, at-tad'im wal-qastara, wal-qastara. Then you have to stay on medication, and this is what we call secondary prevention. So means that once you document blockages on your arteries, you need then medication, you need then changing your lifestyle, you need then treating your hypertension, you need then treating your diabetes to preserve the opening of your arteries and to prevent further blockages on your arteries. I think we went through the whole topic. We do hope that everything was clear to you and was explained. And we wish you really the best to follow all these recommendations and help us to help you decrease the burden of cardiovascular disease in the Emirates, in the United Emirates, and the whole region, including the whole Middle East, where this cardiac disease and coronary artery disease are the first killer in our region. Thank you very much for your listening.